and they are telling you they are going to put in 25 facilities. Different.
Yes.
Yes.
The beauty with it also is most of the counties are struggling with the maintenance of the equipment.
Correct.
Now, for the next 7 years, the vendors will be maintaining this equipment at an uptime of 98%. That's the internal target that we have given ourselves. And we'll have a call sign, and we're even opening a regional office in Nakuru where the county can be able to reach in case there is any slight delay on any of the equipment.
And that was part of what we had a problem with previously. Because you would have a breakdown of our equipment. And by the time we get the people from Nairobi
to come here.
2-3 weeks later. So patients really suffer.
Yes.
So, when we were explaining to people that this is, when we were negotiating this model, we had difficulties with many people.
I remember,
including
the government. But we bought people. We didn't understand.
Many of them don't understand. Because people are stuck in procurement. They want to buy so that they get a commission and those kind of things. But we say there is no need to buy an equipment as expensive as this. Because number one, buying is expensive. Number two, maintaining it is difficult. And the consumables are a big problem. So what we are asking is that these suppliers, they provide the equipment, they maintain the equipment, we pay for the service. Because the hospital here is not in the business of buying equipment. It is in the business of treating people.
Quality service.
So that is how we have changed the model. So now, these good people, and I think we have about 7-8 companies who are doing this across. They are going to supply us equipment worth 200 million. Equipment that will be a nightmare for us as a government to buy. Forget about buying, to maintain, even not maintenance, to provide consumables. So, in the old system, we had equipment like this that were brought for a whole year. They were not working.
Even more.
But now it is the business of this guy that this equipment is working. Because if it is not
Because
working,
he wants to be paid.
it is
Exactly.
So, but in the old model, you have staff here. The equipment is down for a month or 2 months. But
He's been paid then, back in the other model, so he doesn't care. He's like, we are in Italy, we represent.
In fact, for now, he's interested with numbers.
How many people have gone through?
Exactly.
So this equipment must be up all the time.
All the time.
In fact, we should say in context, the machine that was in this room broke down a couple of months ago. In Iceland, the governor has been in a lot of trouble. It will have cost us 15 million to fix it. And what we've been doing now is to refer our patients to the cancer center up the road, just within the hospital. But it's a very serious inconvenience. But the commitment that we've seen from this company to walk the journey with us and to ensure that service delivery is not interrupted is highly appreciated. And we hope it is sustained that way. In
addition, Your Excellency, in the event of any technology upgrade, in the duration of the 7 years, we are mandated to upgrade to the latest technology, which is why this is a 2025 machine as late as June this year. So it's the latest of technology. In addition to what you've said, Your Excellency, and payment is only due when we maintain the 95% uptime. So service delivery is key. Quality service delivery is key. Advanced quality delivery of service is key, but it's only paid when the 95% uptime is maintained, which includes all the facilities.
Your Excellency,
that is how transformation happens.
Yes. Empowering everyone.
You have to be innovative. And that's the big problem we have. Many people cannot think beyond the ordinary procurement. People are wondering why haven't we paid? Why were we procured? Where is the tender? Because that's what I keep being asked. Where is the tender for this and that and the other one? The primary objective of government is to treat citizens. owning equipment is secondary. If we can find somebody to own the equipment and we just get the service, the better for us. We don't have to have a huge financial outlay. This equipment is 130 million. We have not paid a single shilling. It is here. What we are going to pay for is the service. Every patient that comes goes through this, through SHA, we pay these people. So it is in his interest that there are consumables. This equipment is maintained because that is how he will make his money. In the old model, we paid him and he left. And then he doesn't care about it.
And Your Excellency, an additional innovation, any equipment needs that the counties or the facilities have. Our turnaround time is less than 2 days. Unlike the procurement process that would have been very lengthy, the equipment is available.
Procurement here, then these are private sector people. They will buy whatever is required within minutes. They don't have to go and engage in a long procurement process.
Yes,
I am very happy with this.
one of the most important is
So first, let me. How many CT scans like this are you going to supply around the hospitals in Kenya?
the requisitions we received are total of 76 requisitions across the country, yes, like this. Yes. By end of this month, we will have installed 40. So we'll be left with 30. This type of equipment. Your Excellency, also one other thing also.
The last model, I think we had ICT scans in a total of 36.
Double.
For the whole time.
Yeah.
And quite a number of them were not even working.
Yeah.
My car was here, was broken down.
Yeah. And there were a lot of referrals to big facilities like this.
Yes.
Now it's going to reverse the referrals because most of the referrals that used to come from those areas will now have an equipment like this. Yeah. This in Molo, this is in Naivasha. Yeah. Your Excellency, also one other thing is the skills transfer. Very important.
Skills transfer.
Yeah, skills transfer. We are also negotiating with the companies so that they are going to send application specialists, people who have been specialized with this kind of equipment, to come and train our radiologists and the radiographers. So they are aware of the latest technology of this equipment.
So we have the same arrangement for all the other major equipment, MRIs.
Thank you. Thank you.
Took a lot.
Yeah.
I remember I called my CEO for help here. Namurema is telling me, they place that. Tunalipa electricity, tunalipa nurses. Kitu si ni hao basi tuna. But now later we had to do a mind shift.
Yes.
It's a good thing. Because we don't even have capacity.
The maintenance of this thing now is up from you. Your job now is to make sure
The quality. Yes.
Patients are queuing here. What are they doing? Yes.
And because it's new, by the time it breaks down, I know it takes less.
It detects, yeah. It detects,
And we are excited.
yeah, and it's also a new model in Africa. I think this is the first time implementing fee-for-service in Africa. Yeah.
Doing transformative work.
Thank you.
One second. And I'm sorry we hadn't seen it.
Now we have to change that name. Yeah.
Slowly.
All of us are going to catch up.
Yeah.
One last one.
Yeah.
It's my CEC here for health, Roslyn, also sits on the SHA board. So we do a lot of, we are very on top of SHA.
Very good.
But you had one question that you wanted, you were telling me last night. Why what the boss is saying is not going to work? I want our boss likes to hear.
Yes, Your Excellency. I have one concern, and we have one concern as a county and as a hospital. When we say outpatient services are free,
Yes.
there's a component of outpatient services that is not covered under PHC, the primary health care. So, which is the non-communicable diseases like diabetes and hypertension. And the burden for non-communicable diseases in Nakuru is very high. So the minute the citizens expect that they will come and get treated, Her Excellency the Governor needs to pump in about 3 billion shillings into her budget to take care of that, because it's not covered under PHC. So one little amendment I would request personally is, one, to encourage registration, and then to say once you're registered, pay up under shift. Do your means testing. So that when you come to the hospital, you're not going out of pocket for the services that PHC does not pay for. In Nakuru, for example, we have 15 hospitals. This is the 16th, but this is level 5. So it doesn't offer primary health care. But our 15 hospitals, Your Excellency, applied, level 4, applied to provide primary health care services because of the coverage. We didn't want our patients to come to the level 4s and be turned away. So they're providing those services, but they're AFIF generating facilities, like you said yesterday, Your Excellency. So there's a bit of a tension there between the facilities' capability to provide full PHC and SHIF, Your Excellency.
Now, 2 reasons. Yeah. Initially, PHC was not supposed to be covered in level 4 hospitals. It is facilities like yourself, because you were worried that maybe some patients, our thinking was this must be a referral system, where somebody does not come direct to a level 4 hospital. They need to have been taken through the process down at the lower facilities. But we made a small adjustment to say level 4 hospitals can also provide primary health care, right?
Correct.
So, which was an adjustment.
Yes, correct, yes.
Which we made.
Yes.
Now, maybe then what you people can do is to see, now that there was that adjustment, can we also make an adjustment on now the level 4 hospitals that are providing that service, so that service can be captured under SHA?
Yes.
So that can be paid for. And you see, that's an adjustment that can be made.
Yes.
But it must still continue.
Yes.
That the public must still understand that any outpatient service is free.
Yeah.
It cannot be free in level 2 and level 3, but paid in level 4. Then we introduce a disconnect.
Yeah.
Yes. So you people now, as professionals, should adjust. Either you don't provide primary health care in level 4, so that it is uniform, or if you provide in level 4, then we adjust the SHA payment program to include facilities. So this is an adjustment.
That's a better way.
And you people now, as practitioners, you can recommend. Yes. Because you understand, this is we are chewing gum and walking
at the same time.
At the same time,
yes. And we are trying the best we can, Your Excellency.
Yes.
From a service delivery perspective, sitting on the SHA board, that is my message. We must prioritize exactly what you're saying. Make the shift so that the iteration of the PHC shift model is clarified.
Correct.
So I think because you're here, you could message that at the high level, the chairpersonship, the cabinet secretary, so that we sit and resolve these ones.
But you see, what you're saying is maybe 10-20%. 10%. But that is an area which needs to be fine-tuned. The same way we were fine-tuning to make sure that we don't start people from facilities, we can also make adjustments now in SHA to make sure that that particular service is coming. So those are the things we should Yes, yes. But that kind of feedback is good, not just to me, but also to the board as we improve the service. It's just 1 year of doing many things. We are implementing this program.
No, she was worried because you said they called the police. So she can't be panicked at night. Yes, we are. Call the police.
Maybe you can explain this to us in
But we are 100% on board.
Yes.
And we are getting a lot.
Let me ask you a question.
Ask me a question, Your Excellency.
This facility,
Yes, sir.
before SHA,
Yes.
how much money did you, if you compare the money today you get from SHA and the money you used to get from NHI, is there a comparison?
So Dr. Morema is here, but let me give you one data set. By the time you launched a year ago, on October 1st, this county was owed 600 million in NHIF. Between 1st of October and now, I believe this facility is invoicing close to $1 billion. Out of that 1.1 billion, the hospital has already been paid 800, close to 800 million. So that gives you a perspective that actually it is working. And all that money, because Nakuru is the mother of FIF, all that money is plowed back into the system. So we are able to run our maternity unit here, which delivers more than 800 babies a month. We are able to run a cancer center, which does over 60 radiology sessions. We are able to run a renal unit. Daktari, where is Daktari? We have about 15 renal dialysis machines. So part of the question, answer, Your Excellency.
Both it's really helpful.
Yes.
Your Excellency, since we commenced the SHA, we have lodged claims of 1 billion in this hospital and 77,000. We have been paid 815. We have a remaining balance of 300 million. That's for this particular hospital. But overall, we are owed about 450.
Yes. But all the other facilities also have been paying portions of that money.
Yes.
Yes. All the other facilities.
Yes. However,
dispensaries, health centers, they now get their money directly.
yes. However, you are not able to access how much these level 2 and level 3 are owed.
Yeah, but you know that we have an account with each of them.
Yes.
So they should be able to, you should be able to aggregate from a central point, just for data. For data.
Yeah, but if you are to access that, the way you are doing with the level 4 and level 5,
Yes.
better because of reporting. You have to keep on reporting revenues to the COB and so on.
Very good.
But for now, you're not able to do that. You have to wait for phone calls and all that.
No, so what is the problem? DHA, you should work with DHA,
Yes.
so that they can help you.
Yes.
The DHA should be able to do it.
Okay.
The digital health authority.
You're right, Your Excellency.
And part of why we get killed, because you look in the news and see that, oh, this county has so many bank accounts, I don't know what, and wananchi wanafikiri ni pesa tunaiba. Part of it, as she said, Nakuru is the mother of FIF. We've had it since I was speaker, that law. Each facility has its own bank
That
account.
is correct.
But now watasema uko.
No. We want every facility
we
to
are
have
trying
its
to
own
do that, and that has really
because we are
helped
now
our
sending
facilities.
money direct to every facility
Yeah.
for the patients they see.
But in the meantime, rest assured, Your Excellency, all our hospitals, all our health centers, all our dispensaries are receiving the reimbursement, and they are plowing it back. That's the key.
Beautiful.
Yes. We have, yeah, grocery, trauma center. Grocery, trauma center. And Dr. We've actually decided not to make it now a trauma center.
How you want it.
Maybe the one the trauma center is still to the previous one. But the one who one from which
That's great.
That's great. More than another work.
So I already told Mario.
So plan was ready.
And the contract, Excellency, the contract is on site.
So why let us
We are
begin.
speeding it up. There's somebody from the
You see, once to finalize that, she can also organize with our next program.
Because let's
Okay, we are trying to see what we can do for your hospital. Thank you very much for doing the great job that you are doing. Yeah? Thank you.
Yes. But honestly, the share has and now this is because usually you had a lot of hospitals well run but you don't have enough even afford it. So this is a game changer. I can tell you they're going to have a revolution. Definitely. I mean, I can feel it. As a regional hospital, and then they say I want to help.
Habari zenu. Salama. Najua kwa wengine pande ile. Habari zenu. Haya. Sawa sawa. Sasa habari ya Nakuru? Basi tumekuja hapa kuangalia hospitali. Tutaongea no, I don't know the mic. These are hospitals. Okay. Tumekuja hapa kwa mambo ya hospitali yenu. Niliongea na gavana wetu hapa. Okay, bring the mic.
Patient hapa hivi.
Kwa hospitali na sitaki tuongee sana kwa sababu hapa ni mahali na watu wagonjwa. Mimi nimefika hapa leo kwa sababu ya hospitali yenu ya Nakuru. Mama Susan Kihika aliniuliza tuko na mjengo mkubwa hapa ambaye ilikwama. Akaniuliza kama tunaweza kumaliza hiyo mjengo na tuweke equipment. Na nimekubali na hiyo mjengo sasa imeanza kukamilishwa. Tumetoa shilingi milioni 300 ya kukamilisha hiyo mjengo. Na pia leo asubuhi nimetembelea kuona mwenyewe equipment. Kwa sababu tulikubaliana ya kwamba ili matibabu iwe imekamilika, lazima tuwe na madaktari wa kutosha na health professionals. Lazima tuwe na equipment, vifaa ambazo itatusaidia kujua magonjwa ya wananchi. Leo hapa equipment ililetwa jana, inaitwa CT scan ya shilingi milioni 130 ndio imewekwa hapa. Itasaidia watu wa Nakuru hapa na sehemu za vitongoji hapa, na equipment kama hizo zitawekwa katika zile hospitali zingine zote za kaunti yetu ya Nakuru na hospitali za Kenya. Na jambo la tatu ni lazima tuwe na madawa ya kutosha. So tumeshakubaliana na hawa viongozi katika ile program mpya ile tumetengeneza ya mambo ya matibabu kupitia kwa SHA, kuhakikisha kwamba mahospitali zetu zinashughulikia wananchi wote. Pale nyuma wananchi wengine walikuwa hawawezi kufikia kutibiwa kwa sababu ya mambo ya gharama. Na ndio hiyo tunajaribu kama serikali kuhakikisha kwamba kuna equipment, na mimi nataka nishukuru county government ya Nakuru kwa sababu wao wako mstari ya mbele. Kama hii equipment imeletwa hapa, bado counties zingine bado hawajafikiwa kwa sababu kidogo hawajajipanga. Lakini hii yenu imefika hapa, tutaweka equipment kama hii hospitali ya Molo, tutaweka equipment kama hii hospitali ya Naivasha, na tuhakikisha kwamba Nakuru County iko na equipment ambayo inatusaidia kuwatibu wananchi. Vile vile tunataka tuhakikisha kwamba kuna njia ya wananchi kulipa. Na ndio tuko na program ya SHA, na mimi naamini nyinyi wote mmejisajili kwa SHA ama bado? Mmejisajili? So tunataka tushirikiane pamoja na nyinyi, tunataka tutembee pamoja, na mimi nimefika hapa leo kuhakikisha ya kwamba equipment hiyo inafanya, equipment hiyo itasaidia wananchi wa hapa, na sio hiyo equipment peke yake tumeweka hapa. Tunataka kubadilisha hii hospitali nzima. Nimekubaliana na governor, hii asbestos yote hii tutoe, tubadilishe sura ya hii hospitali, ndio dunia hii iweze kusonga mbele. Otherwise, mimi nashukuru sana kwa kunipokea hapa. Mimi niko na shughuli ya watu wa Nakuru leo, ya shule, ya barabara, ya housing, ya nini, mambo mengine. Otherwise, asanteni sana, Mungu awabariki, na wale ambao hamujisikii vizuri, na waombea Mungu, jameni, msikie vizuri, mpate matibabu na muende nyumbani. Thank you very much. Asanteni sana. Thank you.